Dupuytren's disease is a genetic abnormality usually. It is most common in people of Nordic origin. It's more common in males, and if you have it, you probably have a family member that had it and you just didn't know it. What it is basically a normal type of tissue in your palm, also can happen in the bottom of your foot, but most commonly in your palm, turns into an abnormal type of collagen tissue. And the way it manifests itself is first you have a little bump in your hand and you're not sure what it's from, kind of feels like a callus. Sometimes that bump gets bigger and then sometimes it turns into a cord where it's like a line. That cord tightens over time and you can find that you aren't able to straighten your fingers like you used to be able to anymore. It can take years and years to develop and sometimes it never even gets worse. The treatment options for Dupuytren's are about 3 different things. Other than leaving it alone, which is totally fine if it's not bothering you, it won't cause any trouble unless you get a contracture. The treatment options are either we take a needle and we break up that tissue and straighten your finger out. That's for the smallest type of cords. We can also do an injection of a collagenase, or basically it's a bacteria that eats the bad collagen. It's called Xiaflex, and that allows us to straighten your finger out without making an incision. The most severe ones, especially when you have contractures where you can't get your palm flat on a table, usually require surgery to straighten out. Luckily, the surgery is just breaking up and taking out that malformed scar tissue and that malformed collagen, straightening your finger out and closing it up, and the recovery is usually just about 2 weeks to let the skin heal and you can start moving your fingers right after that. So if you have Dupuytren's disease and you want me to take a look at it, please come down to see me, Dr. Baumgartner at Nadora Healthcare. We can talk about all the different surgical and non-surgical options for taking care of it.